You know, when you think about having to have surgery, hip replacement, you usually think that, you know, people that are, you know, 65, older than that, you know, because they've fallen or whatever. Not necessarily true. David Scarborough is a retired Gulfport fireman that had to have hip surgery not too long ago. How you doing?
Good
to
sir.
see you.
Nice to meet you.
I can tell you're not 65, 70 years old. Tell us your story. Why did you have to have hip replacement surgery?
Well, when I was about 45, I'm 50 now. When I was 45, I started having trouble when I was running at the fire department. And I started getting hip injections, and that went on for about 5 years. And it got to the point where I was actually dragging my leg, and this leg was close to an inch shorter than my left leg.
Wow.
And I was pretty much told if I didn't get it fixed, it was going to mess my knee up and, you know, other parts of my body. So I heard about Dr. Withershine and the great job he does. So I went and seen him, and I'll be honest, he was so I can fix this type of person. You know, I decided to go with him, and it was unbelievable. Did surgery, got out of post-op about 12 o'clock. 4 o'clock, I was walking around the halls.
Yeah, look at this quick snip right here. Walking down the hall with your
carrying the walker.
And you had just got off the surgery table.
Yes, sir.
That's amazing.
It was totally amazing. Everything about it was amazing. The staff, how everybody treated me. It's been 3 months. Me and my wife's doing speed walking, riding our bikes. Everything that I would like to go back to doing, I'm able to do, you know, except for the stuff that the hip has, you know, it tells you can't jump and stuff like that. Other than that, I can do anything that I could have done before.
All right. Great story, David. Thank you.
Yes, sir.
Let's talk to the guy behind this wonderful recovery story, Dr. Withershine. Dr. Daniel Withershine is the, what do I say, the magician or the guru. I mean, he was great. What a great pleasure to meet you.
Pleasure to meet you.
You know, just sitting here talking about it and moving around as easy as it is in the video clip and walking down the hall with his walker over his head right after he got off the table.
Yes, sir.
Talk about,
Yes, sir.
if you would, this new procedure for hip replacement.
Well, what this is called is the direct superior approach. It's a new approach for total hip arthroplasty. Essentially, we use a much smaller single incision, which still allows for adequate visualization and implantation of the components. And essentially what it does, it allows the surgeon to perform a total hip replacement with much less trauma and damage to the surrounding soft tissues, as well as not forcing the leg into an abnormal position during surgery.
Now, you were talking about you know, a smaller incision. We weren't going to show you the incision, but let's just say it is bathing suit safe, because your bathing suit definitely had it. About like this. But normally, isn't it like almost the old,
Yeah.
we're about a foot long?
Well, I don't want us to say something like that for others, but it's essentially about half the size of the normal incision.
Well, it's small.
Yeah,
very small.
Typically, we can get it around 8 centimeters.
Now, we're talking about, you know, it's more versatile type of surgery, that it's easier to work with it.
It is. It does not require expensive tables, does not require anything other than the right tools. And we say versatility is that in surgery, you know, you deal with things as they come. And so with this approach, we also have the options to extend if we needed to for any reason that might present itself. And those happen during surgery. So it's it gives you the ability to correct things or to repair other things that you encounter during surgery.
Now, you know, he mentioned that, you know, he's 50 years old. Would you do something a little bit different? Of course, you really think about, again, like I said at the beginning, hip replacement, you think 65, 70, 75 years old. Is this something that, I mean, the older that we get, you know, our bones are a little bit more brittle?
Yes, exactly. And that's where one of the beauties of the approach, as you just alluded to, the versatility, is you have, yes, bones become more brittle. That means complication rates can occur. And with this approach, you have the full ability to go to a full incision if you need to deal with those complications as they arise. But typically, we've been very fortunate. We've not seen any such thing. And as far as someone 50 years old, I've done 23-year-olds, 40-year-olds, 75-year-olds, 90-year-olds.
Wow.
The approach does not change for the most part. It is still, because we want that, even as people age, we want that faster recovery. We want them to get out of bed sooner before problems occur, things like pneumonia and other complications from people being bedridden for too long. Less narcotic usage, less pain medications because there's less pain with the smaller incision. So you don't have the complications and sequela from those things.
And that's one of the key things too, as you mentioned, the recovery time is a lot less. I mean, as we saw the video, him walking down the hall, again, I keep alluding to that because I'm just amazed.
Yeah.
You know, the gentleman come in dragging his leg, you know, and then he's almost sprinting out the door.
Yeah.
Whenever it's over with.
Yeah, it's a wonderful thing, and most of my patients are able to discharge the following day. And you know, the idea is the future potential for outpatient total hip replacement.
Improved stability. That's one of the things as well too, because a person might think, okay, I've had hip surgery, I have to be careful of how I walk, what I do, and all this. But with this this procedure, they're a lot better.
Right. The idea is with some of the traditional procedures, you would have posterior hip precautions and things like that, not to bend your leg or flex it past 90 degrees, things of that nature. And most of the time, those are released after time. But the idea here is that we do not require those, and your complication rate is much lower, and due in part to less disruption of the soft tissues, so you have that inherent stability and a more natural feel to the hip.
Right. Well, I don't think David will be going out and competing in any gymnastics competitions, but he said, you know, he and his wife do the speed walking, which if you've never seen somebody speed walk, I've got a couple of uncles that do that, and I mean, you are getting into it. So you are using a lot of your hip in
That's
doing
right.
that, and that is absolutely amazing. Now, I guess if someone's thinking that they might need hip surgery, they should go to their primary physician first, get a referral to you.
Well, that all depends on their insurance. As we're finding out now, most people don't require referrals for their insurance anymore.
Wow.
So they can just call and make an appointment.
All right, Dr. Wittersheim, thank you so very much.
Thank
This
you.
is absolutely amazing.
It was my pleasure.
I love coming to Senior Health System and finding out all the great new technology that they have, because I mean, it is just growing by leaps and bounds. And this is another great magical story here. If you'd like some more information, call the number on your screen. If you think, you know, if you need some hip surgery, or someone in your family might need some hip surgery, give them a call, get you know, consultation. You'll be bouncing down the halls in no time.